Are we killing people with sedation and restraint? We're going to find out on this episode of One for the Road. Are our EMS caregivers out of control when responding to behavioral health emergencies? Are we running around out there like a bunch of cowboys with ketamine, haldol, and droperidol in one hand and velcro restraints in the other? Yeehaw! Look, there have been some really tragic and unfortunate events in EMS recently. And I want to make it clear that my irreverent tone isn't trying to make light of those serious, tragic, and unfortunate events. But there is definitely a question mark out there in the minds of media, of the public, and even some EMS caregivers about whether or not the use of restraints and sedation during behavioral health emergencies is dangerous. Are we overusing these interventions? And when we are using them responsibly? These are important questions, and I want to tell you about a recent piece of research that looked at over 785,000 patients experiencing behavioral emergencies that were encountered by over 1,880 EMS agencies. That's a lot. So we're talking about a pretty large group spread over a very large area. Of all of those behavioral health emergencies, only about 28,000 patients received pre-hospital sedation, and only about 10,500 were restrained. Just under 10,000 received both restraint and sedation. Interestingly, another study was done looking at the same data, asking about the initial call for assistance. And what they found was if the initial call for assistance came from a police agency versus the patient or another source, there was no change in how we use that sedation or how we use that restraint. So that idea that the police are encouraging us to overuse sedation or overuse restraint seems to be untrue. The most common reasons for the encounters in this study were found to be alcohol-related disorders, emotional distress, and stimulant-related disorders. And the results were interesting. What they found was in all of those patients that they looked at, none of them, 0, died in the pre-hospital setting. They did find that 6 of those patients died at some point in the course of their care in the emergency room. So that's a total of 0.02% fatalities in the entire patient population. So those numbers tell us a couple of interesting things. First, we're not overusing our sedation or our restraints. The evidence suggests that it's quite the opposite, that we're actually being very judicious in our choices with those interventions. The study also seems to suggest that for the most part, we're managing behavioral health emergencies with the appropriate low-level interventions like verbal de-escalation and patient report skills. It also suggests that when we are employing our sedation and our restraint tools, we're doing so in a reasonable and a safe manner. Now, this is a good time to emphasize that both sedation and restraint can be dangerous. When you decide to sedate or restrain a patient who is in your care, you are 100% responsible for their ongoing appropriate medical care, for their safety, and for their transport to an emergency facility. And that is a huge responsibility, but it also seems like it's one that we are entirely capable of doing well. Know that when a patient is in restraints or they are sedated, they are in a very vulnerable state. And we need to take care of those individuals with a high degree of vigilance, knowing the potential side effects and the dangers of the medications and the treatments that we're providing, as well as the substances that they may have consumed prior to our arrival. In many cases, restraint and sedation are entirely appropriate medical interventions, and we should never hesitate based on an ongoing inaccurate narrative. Provide quality care, including restraint and sedation, when you see that they're necessary for the safety and the well-being of your patient. Thanks so much for watching. I'm Steve Whitehead, and that is one for the road.